They ignored this quiet ER nurse until the night turned critical. And the worst part is you've probably lived your own version of that silence. The moment you knew something was wrong, but nobody with authority looked up. It's 2:11 a.m. in Tucson. Fluorescent light bleaches the color out of faces. The waiting room is packed with tired families, cheap coffee, and swallowed fear. In Trauma Bay, 2 alarms climb like a siren you can't outrun. A patient's oxygen drops. A resident freezes. A charge nurse searches for the doctor who's never where the blood is. In the corner stands Caleb Hart, the nurse they sidelined. He doesn't raise his voice. He just moves. Stay with me, and you'll see how real crises expose real leaders. If you've ever been underestimated, hit like, comment where you're watching from, and don't blink. In Trauma Bay 2, everyone heard the alarms. Nobody heard the hours that led to that sound or the way a whole department can learn to look past the person standing closest to the danger. Earlier that night, Sonoran Mercy sat under the same Tucson stars, but the emergency department had its own weather. The air smelled like antiseptic and burnt coffee, and the fluorescent lights made every face look tired before a word was spoken. The waiting room was beyond full. People sat shoulder to shoulder with winter coughs, sprained wrists, fevers that would not break, and that specific quiet anger that comes from being told to wait when your body feels like it is losing control. A toddler cried until her voice rasped. An older man stared at the floor with both hands clasped over his stomach as if he could hold the pain in place. Behind the intake desk, the printer spit paper like it was chewing through trees. Clipboards stacked and slid. Pens went missing. A security guard leaned against the wall and watched a family argue in whispers about whether to leave. Nobody did. They rarely did. Once you made it inside, you stayed because the outside felt worse. 2 ambulances idled near the bay doors, engines running red lights washing the concrete in slow pulses. The paramedics inside were not lazy. They were trapped. No beds, no rooms, no staff to take the next handoff. The system held its breath and called it routine. Caleb Hart walked in at 11:58 with a backpack slung over one shoulder and a posture that never fully relaxed. He moved like someone who had learned to keep his balance on uneven ground. There was nothing dramatic about him. No swagger. No attention-seeking. He wore scrubs that fit cleanly and shoes that had been scrubbed so often the leather looked tired. His badge swung once and settled against his chest. He clocked in without speaking, then stopped at his locker and pulled out a stethoscope with a cracked rubber tube that had been taped twice, not for appearance but because he hated waste. He tied the strings of his scrub top with quick fingers, precise the knot tight and flat. The motion had the economy of habit, not nervous, not rushed, just practiced. A nurse at the counter glanced up long enough to register him, then returned to her screen. "Caleb," she said the way you say a name when it is only a label for a task. "You good?" He nodded. "Yeah." That was all. The conversation ended because there was no space for anything else. He had been on this unit a few months long enough for people to decide what he was, short enough for nobody to wonder if they were wrong. He was the quiet one. The new guy. The nurse who charted too carefully and spoke too softly. The nurse who did not complain when the hard patients landed on his assignment. The nurse who never joined the break room gossip, even when someone tried to pull him in. Caleb stepped into the main corridor and let the noise wash over him. Monitors chimed. A call bell rang until someone silenced it. A stretcher squealed as it turned a corner too fast. In one room, a woman laughed loudly at a joke nobody else found funny. In another, a man cursed at the ceiling because his IV hurt. The department did not sleep, it only changed tempo. At the charge desk, Marissa Klein stood with a clipboard pressed to her palm like a weapon. She was lean, and wired hair pulled back tight enough to make her cheekbones sharper. Her eyes ran across the board, then across the floor, counting bodies the way you count seconds when you are already behind. "You're kidding me." she muttered, not to anyone in particular. A unit secretary looked up. What now? We're down 2. Again. Marissa tapped the board. One called out sick, one got pulled upstairs, and they sent me nobody. She did not wait for sympathy. Sympathy did not add staff. She pivoted, scanning the room for whoever she could place like sandbags before a flood. Caleb approached quietly and stopped at the edge of her space. He did not interrupt. He waited until her eyes cut his direction. "Hart," she said. "Yes, ma'am." Her mouth tightened at the politeness. She was not a woman who enjoyed being reminded of hierarchy when she was the one drowning in it. "Your overflow and secondary tonight. Keep fast track moving. Keep the hallway beds from turning into a camp." Caleb looked past her shoulder at the trauma bay doors. They were closed for now, but he could hear the rhythm behind them, the sharper voices, the heavier equipment. He kept his face neutral. "Copy," he said. Marissa paused as if expecting an argument that would justify her irritation. When none came, she turned away. "And stay out of trauma unless I call you in." Caleb nodded once, understood. He walked toward the overflow side of the department where the rooms were smaller and the problems looked less dramatic on paper, but had a way of eating the most time. He passed a new nurse who was trying to hang fluids while her hands shook. She was young hair escaping her ponytail, eyes wide with the kind of fear that comes from not wanting to be the one who makes the mistake that harms someone. Caleb stopped. "Need a hand." She blinked at him like she had forgotten that help existed. "I can't get the spike in. It keeps slipping." He stepped close, kept his body angled away from the patient to give space. "Hold the bag steady. Don't fight it. Let the plastic do what it wants." He guided her fingers without grabbing the equipment from her, and the spike slid in with a soft pop. The bag started to drip. The nurse exhaled as if she had been holding her breath for a full minute. "Thanks," she whispered. Caleb gave a small nod and moved on. At the far end, Luis Navarro stood at the respiratory station with his arms folded, watching the room through the glass of his reading glasses. He had the calm of someone who had spent decades near people who forgot how to breathe. His hair was mostly gray now. His hands were big, steady, scarred in small ways. He looked at monitors the way some people look at faces, noticing patterns others missed. Luis saw Caleb move past and did not look away. He tracked him, not like a supervisor, more like someone recognizing a language. Caleb felt the attention, but did not react. He had learned long ago that attention often came with expectation, and expectation could turn into blame. He started his first round in overflow reading charts, listening to lungs checking IV sites. He spoke to patients with a tone that did not rise or fall. Calm was not a performance for him. It was the way he kept the room from stealing his own air. In room 12, an older woman with COPD sat upright, breathing fast, eyes panicked. "I can't," she rasped. "I can't get enough." Caleb set his hand on the bedrail close enough to be present without invading. "Look at me," he said softly. Her eyes snapped to his. "Breathe in through your nose," he said. "Slow. Then out like you're blowing through a straw. You're not trapped. You're moving air. We're just making it easier." Her shoulders twitched with each breath. Caleb watched the accessory muscles at her neck, listened to the wheeze, checked the tubing for kinks. He adjusted the oxygen, then asked for a nebulizer. His voice stayed level, and the woman's breathing began to follow it like a hand finding a rail in the dark. In the hallway, someone shouted for a blanket. Someone else shouted for pain meds. The unit secretary yelled a name. A resident hustled by holding a chart, eyes locked on a screen as if the answer could be found in pixels. Caleb stepped back into the corridor and nearly collided with Dr. Spencer Vaughn as the attending pushed through the double doors. Vaughn moved like he owned the air in front of him. He was in his late 40s, hair neatly combed, white coat, crisp face, already sharpened by irritation. He had the kind of confidence that came from being the final decision in rooms where people begged for decisions. He did not apologize for the near collision. He barely registered Caleb as a person. "Where's my board?" Vaughn snapped at the charge desk. Marissa spun toward him. "On the screen. Same as always." Vaughn leaned in, scanned, then frowned. "We're boarding 6. Since when?" "Since the hospital stopped having beds," Marissa said, voice clipped. Vaughn's eyes flicked over the staff, measuring who looked useful. They passed over Caleb without stopping the way you glance at a wall while searching for a door. A resident approached with a question voice uncertain. "Dr. Vaughn for bed 4. The abdominal pain the labs show lactate is up, and the pressure is trending down." Vaughn's head turned sharply. "Then you get imaging, and you call surgery if it's surgical. Don't bring me a problem you can solve." The resident nodded quickly and retreated. Caleb stood at the edge of the cluster and said not loudly, "If lactate is rising with hypotension, you might want fluids started and consider sepsis protocol." The words were correct, simple, time-sensitive. Vaughn did not turn his head. "Somebody competent," he said into the space, "tell me how many beds we can clear in the next hour." Marissa's jaw flexed. She answered, and the moment closed like a door. Caleb did not react outwardly. Inside, something small settled. Not hurt, not anger, more like confirmation of the rule. Speak only when it matters. Speak only when you can carry the weight of being ignored. He moved to the charting station and began documenting his assessments with a precision that would have annoyed anyone looking for shortcuts. He wrote times responses, oxygen settings, lung sounds, the exact words patients used when describing their pain. He did not embellish. He did not soften. He wrote what was there. A nurse at the next computer glanced at his screen and smirked. "You always chart like you're writing a novel." Heart. Caleb kept typing. "It's accurate." "Yeah," she said. "So accurate it'll get audited." Caleb's fingers paused for half a second. Then they continued. "Then it'll pass." She rolled her eyes and turned away. Luis watched that interaction from his station. He did not smile. He did not frown. He simply filed it away. The department pressed forward. A teenager came in with a laceration from a broken bottle. A man arrived sweating and pale, insisting he was fine while his wife insisted he was not. A homeless veteran sat quietly in the corner with trench foot and a stare that went far past the walls. Marissa moved through it all like a blade cutting through water. Orders snapped from her mouth. Bed 7 needs labs. Bed 9 needs a line. Who has a discharge? Who can take triage? Nobody answered fast enough. She answered for them. Caleb took what she gave him without complaint. Not because he was passive, but because he refused to waste energy on a fight that did not help the patient in front of him. He had learned how quickly pride could become a luxury. At 1:20 a.m., the waiting room erupted. A man slammed his fist on the counter. "My mom has been here 3 hours." The unit secretary looked up, eyes tired. "Sir, we're doing the best we can." "That's not good enough," he snapped. "She's 84. She can't breathe." Marissa stepped in posture, rigid. "Sir, you can either lower your voice or you can leave. Your mother will be seen. That is not negotiable. But you will not threaten my staff." The man's face reddened. He glanced around, realized security was watching, and swallowed his anger into silence. Caleb watched from the hallway bed he was checking. He saw the mother, a small woman with the thin hair, eyes glassy. He saw the way her chest rose shallowly. He moved closer, checked her saturation. It was low enough to matter. He placed oxygen, adjusted the flow, and watched her color improve. He did not announce it, he simply did it. The son noticed and whispered thank you. Caleb nodded, still focused on the woman's breathing. "She's working hard, we're helping her." The son's anger drained into something else, something softer and ashamed. He stepped back, hands clasped. Louis saw that too. At 2 a.m., Marissa tried the staffing office again. She stood at the phone listening to ringing that did not turn into an answer. When she hung up, she stared at the wall for a beat longer than necessary. The unit secretary asked quietly, "1." Marissa shook her head once. Silence, like always. She looked out at the department, at bodies and beds, at faces in the waiting room. Her eyes hardened. Fine, we do it ourselves. Dr. Vaughn returned from a trauma consult upstairs, irritation deeper now. Why is that ambulance still sitting out there? Marissa's voice cut. Because I have nowhere to put the patient. Make room, Vaughn snapped. Marissa met his gaze. With what staff? Vaughn's lips thinned. He did not answer. He hated being reminded that authority did not manufacture resources. Caleb continued moving through overflow, handling problems that looked small until they were not. A diabetic patient's glucose dropped dangerously low because he had been NPO for imaging that never happened. Caleb caught it, pushed dextrose, and watched the patient's eyes clear. A teenager with asthma started to tighten up, wheeze, turning sharp and high. Caleb called respiratory before the panic set in, and Luis arrived with a nebulizer already primed. Luis glanced at Caleb while he adjusted the mask. Good catch. Caleb's answer was quiet. He was tiring out. Luis watched him for an extra second. You see it early. Caleb did not offer an explanation. He simply looked at the patient, then back to the monitor, then down the corridor where Marissa was arguing with radiology about an imaging slot. Luis returned to his station but kept his eyes on Caleb longer than he had planned to. Midnight slipped into the kind of time that did not feel like a new day. The air conditioner hummed too loud. The fluorescent lights never softened. Staff moved with the fatigue of people who had already burned through their first reserve. Caleb took a sip of water at the counter, then set the bottle down with the cap aligned neatly beside it. Small habits. Order in a place that fought order. A resident hurried past him and nearly tripped over a power cord. Caleb caught the cord with his foot before the resident fell. The resident did not even notice. He just kept moving, muttering into his phone. Marissa called out heart. Caleb turned immediately. Yes, she pointed to a hallway bed. That chest pain in the hall is climbing the wall. Keep him calm. His EKG is normal, but he's not. Caleb walked over. The patient was a man in his 30s, sweat on his forehead, breathing fast. His eyes darted like prey. I'm dying, the man said. I know I am. It's happening. Caleb pulled a stool close and sat so he was not looming. Look at me, he said, voice steady. The man's gaze locked to his. Your heart rhythm is stable right now, Caleb said. That's not me guessing. That's the monitor. Tell me what you felt. The man swallowed hard. Pain, tight, like a fist. Caleb nodded. Any drugs tonight? The man hesitated. No. Caleb waited silent, not accusing. The silence did what shouting could not. The man's shoulders slumped. Coke, he admitted. Earlier. Caleb did not react. Okay. That helps us treat you. You're not dying in this moment. You're scared and your body is reacting. Breathe with me. He counted slowly and the man followed. The panic eased. Caleb's tone never changed. Across the department, Vaughn glanced over and saw Caleb sitting in the hall with a patient, calm, as if time still existed. Vaughn's eyes slid away. He did not like calm he could not control. Luis watched that interaction and felt something tighten behind his ribs. Not envy, not irritation, more like a recognition of discipline. The kind of calm that did not come from comfort. The night kept pushing. The printer kept spitting paper. The waiting room kept filling. A nurse dropped a syringe and cursed under her breath. A different nurse whispered, I can't do this, then wiped her face and did it anyway. Caleb moved between beds, checking lines, listening to lungs, adjusting monitors. He fixed a pulse ox that was reading low because the probe was cold and placed wrong. He warmed the patient's hand with his own for a second, then repositioned the sensor. The number jumped to normal. The patient exhaled in relief, not knowing the machine had been lying. He noticed a bag of saline hung too high, dripping too fast. He adjusted the rate without drama. He noticed the way a patient's voice sounded wet, the start of fluid in the lungs, and he called for a reassessment before it became a crisis. Marissa walked by and saw him doing it. She did not stop to praise him. Praise was not her language. But she paused long enough to make sure the adjustment was correct, then kept moving. At 12:45, the department reached a strange plateau where the noise stayed constant and the fatigue became a physical thing. The staff had settled into the rhythm of barely keeping up. The kind of rhythm that felt stable only because nobody had time to imagine it breaking. Luis stood at the radio desk and looked at the ambulance bay through the glass. The two vehicles outside still idled, lights spinning lazily. He could see paramedics shifting in their seats waiting to offload. He could see the street beyond empty and dark. Caleb finished another note, then looked up. His eyes moved, not wandering, scanning. He took in the board, the room assignments, the faces of staff, the flow of stretchers. He did not look anxious, but his jaw set slightly as if he could feel the air changing. Marissa returned to the charge desk and pressed her fingers against the edge of the counter. For a moment, she closed her eyes, then opened them and stared at the floor map on the screen as if she could force it to rearrange itself. Vaughn stepped up beside her. "I want Trauma 1 ready." Marissa did not look at him. "It's ready. As ready as it can be." Vaughn's phone buzzed. He glanced at it, frowned, then pocketed it. Luis adjusted a ventilator setting on a patient in room 5, then turned back toward the center of the department. He caught Caleb's gaze for a fraction of a second. Caleb's eyes were steady, but there was something in them that felt like distance, like he was listening to a sound nobody else could hear. The radio sat silent on the desk, its small red light steady. Then the speaker crackled, and Marissa's head snapped up as if a string had been pulled tight. The radio sat silent on the desk, its small red light steady. Then the speaker crackled, and Marissa's head snapped up as if a string had been pulled tight. Sonoran. "Mercy." "Stand by the dispatcher," said voice clipped and breathless. Paper rustled on the other end, the sound of a person reading numbers that could not be made gentle. "Dust storm rollover on I-10 near Twin Peaks. Multiple vehicle pileup. Multiple critical. At least 14 patients. 2 confirmed pediatric. First unit is 4 minutes out. Additional units behind them. For a beat, nobody spoke. The emergency department did not freeze because it did not know what to do. It froze because it understood exactly what those words meant inside a building already short on hands and space. Marissa reached for the overhead microphone without looking down. "Mass casualty," she said, voice flat like a hammer striking a nail. "All hands to stations, clear rooms, clear hallways. If you can discharge, do it now. If you can move, move now." The unit secretary's fingers flew across the keyboard, firing off alerts. Phones started ringing at once. A resident cursed under his breath and jogged toward the trauma bays. A tech pushed a cart of linen toward the hallway like it was ammo. Dr. Vaughn stepped in beside Marissa, his posture sharpening. "How many trauma bays do we have ready?" "As many as physics allows," Marissa said. She lifted a hand and pointed without turning her head. "Bed 1 and 2 become red. Bed 3 becomes airway overflow. Hall beds become yellow staging. Fast track gets green and gets moved out. Luis, I want oxygen, and vents set." Luis had already started moving. He did not ask why. He wheeled a ventilator toward the bay doors and checked the tank pressure with one quick glance, then another. His mouth set in a line that meant he was counting supplies in his head. Caleb stood near the charting station when Marissa's eyes found him. They stopped on his face a fraction longer than usual, long enough to measure him again, like she was rereading a label she thought she already understood. "Heart," she said. "Yes. Your overflow lid. You keep the secondary and green moving. You keep the hall from clogging. You hear me?" Caleb's gaze flicked toward the trauma bay doors. The air beyond them felt thicker, as if the building itself was bracing. He did not argue. He did not ask to be moved closer to the center of impact. He simply nodded. "I hear you." Marissa leaned closer, voice lower. "Do not step into a trauma bay unless I call you in." Caleb met her eyes. "Copy. Vaughn watched that exchange with a faint tightening at the corner of his mouth, like the sight of a quiet nurse being given responsibility irritated him. He turned away and snapped at a resident. "Get me a rundown of blood inventory. I want massive transfusion ready." The resident hurried off. The first siren arrived like a knife through the night. It rose and fell outside the ambulance bay doors, then stopped abruptly, replaced by the thud of boots and the squeak of stretcher wheels hitting concrete. The automatic doors slid open, and Tucson air poured in, carrying dust and heat and the sharp chemical smell of gasoline. The first gurney came through with a paramedic riding the rail, one knee braced, hands on the patient's shoulders to keep him from sliding. The man on the stretcher was covered in a film of dirt blood matted in his hair. His eyes were open but unfocused. 35, male, the paramedic called, voice loud to cut through the rising noise. Rollover ejected. GCS 10. BP 80/40. Pulse 130. Suspected pelvic fracture. We started 2 large bore and pressure bag. He's not holding. Marissa was already there, a marker in her hand drawing a red line on a triage tag. Red to trauma 1, she ordered, "Move." A second stretcher followed, then a third, then a fourth, each one carrying its own version of chaos. Screams, groans, a woman with glass in her cheek blinking through tears, a teenager whose arm bent wrong, teeth clenched so tight his jaw shook. The corridor filled with voices, each voice competing to be the one that mattered most. Vaughn stepped into trauma 1, and the room bent around him, not because he was kind, but because he was the highest rank in the storm. He pointed at a nurse. "Get me airway, get me suction, get me ultrasound." Marissa moved between bays like a switchboard, connecting the right person to the right task. Bed 2, chest, trauma, tag red. Bed 3, abdominal tag yellow. Hallway staging 3 yellows, 2 greens. Caleb held his position at the edge of overflow, watching the surge hit the department like water hitting a cracked dam. He could feel the moment when routines broke down and people started making decisions by instinct instead of plan. A green, tagged patient stumbled into his area, hands pressed to his scalp, blood slipping through his fingers. "I can't feel my legs," the man said, eyes wide, voice shaking. Caleb stepped close enough to steady him without grabbing. "Sit," he said, "right here." The man dropped into a chair as if his bones had turned to sand. Caleb crouch-checked the man's pupils, scanned his neck. "Look at me," he said. "Can you move your toes?" The man blinked hard. His foot twitched. Caleb's fingers pressed gently along the man's spine, through his shirt, checking for tenderness, swelling, deformity. "Any pain in your back?" "Just my head," the man said, breathing fast. "My head is splitting." Caleb looked at the scalp wound. It bled a lot, but it was not arterial. He applied pressure with gauze and held it firm. "You're bleeding. It looks worse than it is. We're going to keep you stable and get you seen." Across the room, a nurse called out, "We're out of pressure bags." Marissa's head turned sharply. "Find them," she snapped. The nurse spread her hands. "They're gone." Marissa's eyes narrowed fury, flashing not at the nurse, at the reality. "Then we make do." Caleb stood eyes scanning supplies. He moved to the storage cabinet. Opened it, found 3 pressure infusers shoved behind a stack of blankets like someone had hidden them for later. He pulled them out and carried them to Marissa without a word. Marissa saw them and her jaw flexed. She did not say thank you. She grabbed them and shoved them into a nurse's hands. "Use these. Now." Caleb turned back to overflow. A young woman was wheeled in green tag, but her face was pale under the dust. Her hands trembled violently. "She won't stop shaking," the EMT said. "She was trapped in her car for 20 minutes. No obvious fractures. But she's panicking." Caleb put a hand on the gurney rail and leaned in, voice low. "What's your name?" "Savannah," she whispered. "I can't breathe." Caleb watched her chest. It rose fast, shallow. The oxygen reading was normal, but her body was in freefall. "Savannah, listen to me," he said. "You're breathing. Your lungs are working. Your brain is telling you you're not safe. That's what we fix first." Her eyes locked to his like a lifeline. He guided her through slower breaths the way he had done with the chest pain patient earlier. Only now the room was louder. The chaos closer, the air thick with adrenaline. Behind him, the trauma bays erupted into argument. "I want him tubed," Vaughn barked. A nurse responded. "His pressure is tanking. Tube him anyway," Vaughn said, voice sharp. "He's not protecting his airway." Marissa stepped into the doorway, eyes hard. "If you sedate him now, you're going to drop his pressure to 0. Vaughn spun on her. "Are you running this bay or am I?" Marissa did not flinch. "I'm keeping him alive long enough for you to run it." The room went tight around that line. A resident glanced between them like a child watching parents fight. Luis moved toward the bedside with a ventilator. He looked at the patient's chest rise, the oxygen number slipping, the blood pressure narrowing. His hands hovered over the intubation equipment, waiting for a decision that would not come cleanly. Vaughn jabbed a finger toward the resident. "Push etomidate. Now." Marissa stepped forward, blocking the medication tray with her body. "Fluids first," she said. Vaughn's eyes flashed. "Do not obstruct me." Marissa's voice dropped colder. "I'm not obstructing you. I'm telling you his veins are empty." The patient on the bed moaned a wet sound that caught in his throat, as if his airway was already failing. The monitor beeped faster, warning without emotion. Luis leaned closer to Vaughn, voice low enough not to inflame. "Doctor, his oxygen is slipping and he's tiring." But her point stands. He's on the edge. Vaughn's jaw clenched. He hated being boxed in by facts. He hesitated, and that hesitation did something to the room. People saw it. The authority wavered just a hair. Marissa seized the gap. "Pressure bag, 2 liters. Get a manual cuff," she ordered. "We stabilize, then we tube if needed." Vaughn exhaled sharply through his nose, then snapped, "Fine. Move." The resident pushed fluids. The nurse squeezed the pressure bag. The patient's pressure climbed just enough to buy a few breaths. In overflow. Caleb finished calming Savannah enough to stop her hands from shaking. He checked her pupils again, then her wrists, then the color of her lips. He did not treat her panic as a nuisance. He treated it as a symptom that could kill because he had seen fear turn into cardiac events in bodies already stressed. Savannah's voice cracked. "Am I going to die?" Caleb held her gaze. "Not here," he said. "Not like this." A nurse hurried past him, face flushed. "We need more IV kits and trauma too." Caleb looked at the supply cart beside him. It was half-stocked. The rest had been scavenged already. He did not wait for orders. He moved to the central supply closet, scanned the shelves, and started building kits with quick hands. Gauze, tape, catheters, flushes, tourniquets. He lined them in a row like someone prepping gear. Luis glanced over and watched Caleb assemble the kits without looking at the labels twice. Not because he was careless, because he had already memorized the feel of each piece. A resident ran toward the closet and stopped short when he saw Caleb. "Who told you to do that?" Caleb did not look up. "We need them." The resident's mouth opened, then closed. He grabbed 2 kits and sprinted away. Caleb continued. Outside, another siren arrived, then another, overlapping in pitch, until the sound became a constant pressure. The automatic doors kept opening. Each time they did, dust swirled in, clinging to hair and skin like a second layer. An EMT entered, carrying a child in his arms. The child's face was streaked with dirt, eyes half open. "Peds," the EMT called, voice louder now. 7-year-old female. Seatbelt bruising. Abdominal pain. BP 90, pulse 140. Marissa's face tightened. She pointed. "Trauma 2. Now." Vaughn's head turned at the word pediatric irritation, briefly replaced by focus. Pediatric trauma did not tolerate ego. It demanded precision. Caleb watched the EMT disappear into the bay with the child and felt something pull in his chest. A reflex he did not show on his face. He returned to his kit's hand, steady. A green, tagged man with a broken wrist started yelling from a chair. "I'm bleeding everywhere and nobody cares." Caleb approached, voice firm but even. "Show me." The man thrust his wrist forward. It was swollen, bruised, but not bleeding. Caleb wrapped it, immobilized it, checked cap refill. "You're hurt, you're not dying, sit tight." The man's anger faltered under the calm certainty. He stared at Caleb, then looked away, embarrassed. A nurse leaned in toward Caleb as she passed, voice strained. "I can't find Marissa. They're shouting in Trauma 1 again." Caleb looked toward the trauma bays. The voices were sharper now. The kind that came from fatigue and fear turning into friction. "She's there," Caleb said, just loud. The nurse swallowed and moved on. Across the hall, a yellow-tagged patient lay on a stretcher with a blanket pulled to his chin. He looked stable, eyes open, answering questions. A paramedic had written his vitals in thick marker on the triage tag. Caleb glanced at the tag as he passed. BP 110/70. Pulse 98. Oxygen 95. Complaints of chest tightness and dizziness. Not alarming, not urgent, not yet. Caleb paused long enough to look at the man's face. The skin around his mouth was slightly gray. His breathing was shallow. His eyes blinked slowly as if his body was conserving energy. Caleb leaned in. "Sir, can you tell me your name?" "Dylan," the man said. "I'm fine. I think I just got scared." Caleb nodded. "Any pain anywhere?" "My ribs." "Maybe." I hit the wheel. Caleb's eyes tracked down to the man's abdomen. The blanket hid most of it. He lifted the edge just enough to see. The belly looked flat, but the man's hand rested there as if instinctively guarding something. Caleb set the blanket back. "If anything changes, you tell me." Dylan managed a weak smile. "Okay." Caleb moved on, but he kept Dylan in his peripheral. In Trauma 1, Vaughn finally intubated the ejected patient after pressure came up. The tube slid in. Luis confirmed placement with a capnography waveform and a steady rise of the chest. For a moment, the room exhaled. Then another stretcher rolled in. 2 more reds and EMT shouted. 1 altered, 1 hypotensive. Marissa stepped toward them, marker in hand, already choosing where to put bodies when there were no bodies left to place. "Put altered in Trauma 3, she said. "Hypotensive in Trauma 2 after PEDS clears. Hallway red staging for the next one." A nurse protested, "We don't have Trauma 3 open." Marissa's eyes did not blink. "We do now. Move the stable patient to overflow." The stable patient was not stable, just quiet. Caleb watched the transfer happen. The patient moved into overflow, eyes wide, hands clenching the blanket. He stepped in to help. He did not take over. He guided the gurney into place so it did not snag cords. He checked that the oxygen line reached. He glanced at the monitor leads. One was misclipped and would read wrong. He fixed it. The oxygen number changed. Not drastically, but enough that a nurse noticed. She frowned. It was reading 88. Caleb's voice stayed soft. Lead was loose. Try a different finger for the pulse ox, too. His hands are cold. The nurse did as he said. The number climbed to 94. She stared at Caleb for a second like she wanted to ask why he cared about a loose lead in the middle of a mass casualty. Then she turned away, too busy to wonder. Luis watched that exchange again. The same pattern. Caleb did not seek attention. He erased small errors before they grew teeth. A resident stepped into overflow, hair damp with sweat. "We need another set of hands. Marissa is asking for someone to run secondary vitals." Caleb answered, "I'm already on it." The resident's eyes flicked to the green-tagged patients and the yellow stretchers lined along the wall. He looked surprised by the organization. The supplies were staged. The charts were labeled. The monitors were not screaming at random. "How did you—" The resident started. Caleb cut him off gently. "Tell her I have overflow." The resident nodded and hurried away. The dust storm outside had not ended. It pressed against the building like a living thing. The ambulance bay doors kept opening, and each opening brought another smear of grit across the floor. A woman stumbled into the ER, on her own feet, blood on her hands, eyes wild. "My husband," she said. "He's still out there. They said he was coming." A nurse tried to catch her. "Ma'am, you can't be back here." The woman pulled away, voice rising. "You don't understand. He's bleeding. He was stuck. Please." Caleb stepped toward her, not fast, not aggressive. "Ma'am," he said, voice steady. Her eyes snapped to him. "What's your name?" he asked. "Kara," she whispered. "Kara." "I need you to breathe," Caleb said. "In, out. Good. Now tell me his name." "Ethan." "Do you know what car he was in?" Caleb asked. She shook her head, tears streaking through the dust. "A truck. A blue truck." Caleb nodded and looked at the unit secretary. "Can you check incoming list for Ethan blue truck mail?" The secretary's fingers moved over the keyboard. "We have an Ethan Reynolds mail 41 en route. 2 minutes." Kara's knees buckled. Caleb caught her elbow and guided her to a chair. "He's coming," he said. "You're going to sit right here. You're going to drink water. When he arrives, we get you an update." Kara clutched his wrist. "Promise me." Caleb did not promise what he could not control. He met her eyes anyway. "I'll find out." Kara's grip loosened slightly. She nodded, shaking. Caleb moved away, already pulled back into the machine. In Trauma 2, the pediatric patient's monitor beeped fast, then faster. A resident called for ultrasound. Vaughn pushed through the doorway, irritation replaced by focus. Marissa stood at the foot of the bed, hands planted on the rail. "Her pressure is dropping," she said. Vaughn glanced at the numbers. "Get me access." "We're trying," a nurse snapped. Vaughn's eyes cut toward the nurse. "Try faster." Marissa's voice rose. "Stop biting your own team." Vaughn rounded on her. "Then staff better." Marissa's face went still, the anger turning cold. "I asked." They sent silence. For a second, the trauma bay felt like a pressure vessel about to burst. Luis stepped in with a ventilator and a mask. His voice was low. "Doctor, she's tiring. We can support now." Vaughn looked at the child, then at the monitor. He nodded sharply. "Do it." Luis moved, the mask sealed, the bag compressed. The child's chest rose and fell. The oxygen number stopped sliding. Marissa exhaled once barely. Out in overflow, Caleb felt the shift in the air when the pediatric bay stabilized. Not because he heard it, but because the noise in the corridor changed slightly. Fewer sharp commands, less frantic running. The calm never lasted. Another wave came through the doors, and this one carried a kind of damage that made voices drop. A man arrived with blood bubbling from his mouth. Another came in silent, skin-waxy eyes half open. A woman's leg was twisted bone white under torn fabric. The EMTs spoke in short bursts, saving breath. Marissa's marker moved across triage tags, red and yellow and green, a language of urgency written on paper that could never fully describe what was happening in flesh. Caleb watched the flow and adjusted his own position like someone reading a map in real time. He moved a cart closer to the hallway beds so nurses did not waste steps. He pulled extra oxygen tubing from storage and coiled it neatly so it would not tangle. He checked the crash cart in overflow and noticed the defibrillator pads were expired. He replaced them without telling anyone. A new nurse approached him, eyes wide. "They said I need to start IVs in the hall, but I've never done it this fast." Caleb looked at her hands. They were shaking. "Pick one patient," he said. "One line. You do it. I'll stand here." She swallowed. "Okay." He stayed beside her, not touching, just present. She found the vein missed, once corrected, then hit. Blood flashed in the catheter. She slid it forward and taped it down. Her eyes filled with relief. Caleb nodded once. "Good. Next one." She did not smile. She simply turned and did the next one, because his calm made it possible. Luis watched that from his station, and the recognition in his eyes deepened. Caleb was not just competent. He was a stabilizer. A person who made other hands steady. Marissa passed through overflow and caught sight of the organization. Her eyes flicked to Caleb, then away. She had no time for reconsideration. She only had time for survival. Vaughn stepped into the corridor, coat streaked with blood now. He barked orders, voice hoarse. "I need a central line kit. I need labs. I need someone to call CT and tell them they work for us tonight." A resident hurried toward Caleb's supply cart, grabbed a kit, and paused. "Who set this up?" Caleb answered without looking up. "Take what you need." The resident hesitated, then left. The department continued to bend and creak. Stretchers lined the walls, wheels locked bodies under blankets. The air was thick with sweat and antiseptic and fuel. The floor grew sticky in places where blood had dried before anyone could mop. A paramedic came into overflow and pointed toward the ambulance bay. "We have 2 more coming, both yellow, possible internal injuries." Marissa did not look up from her triage tags. "Bring them." Caleb's eyes tracked the paramedic's finger. He saw the pattern forming. Yellows that looked fine until they were not. Internal injuries that waited quietly, then crashed. He moved to the hallway stretchers and checked monitors again, one by one. Oxygen, pressure, pulse, skin color, breath sounds, mental status. He reached Dylan, the man from earlier, and paused. Dylan's eyes were still open, but the focus was softer now. His mouth was slightly open, breathing shallow. The pulse on the monitor read 110, then 115. Caleb leaned in. "Dylan," he said, "look at me." Dylan blinked slowly. "Yeah." "Any change?" Caleb asked. Dylan swallowed. "I feel weird." Caleb's gaze dropped to the man's hands. Dylan's fingers were curled slightly, the nails pale. His skin felt cooler than it should. Caleb checked the blood pressure cuff and triggered a reading. The machine squeezed release, then displayed a number. It was lower than before. Caleb did not show reaction. He looked at Dylan's abdomen again. Under the blanket, the slightest rise of distension seemed to be forming, subtle enough that most people would miss it in the chaos. A nurse rushed past. Caleb called her name, not loud, but sharp enough to cut through the noise. "Jenna." She turned, breathless. "What?" "Get me a manual pressure on this patient," Caleb said, "and bring fluids." Jenna frowned. "He's yellow." Caleb's eyes stayed on Dylan's face. "He's changing." Jenna hesitated, then nodded and moved because something in Caleb's tone did not allow debate. Dylan's oxygen monitor chirped, once a different pitch than before. The number dipped, then corrected, then dipped again. Caleb watched it, then reached for the probe and felt Dylan's finger. Cold, poor perfusion. The pulse ox was losing signal, not necessarily oxygen. Still, the change mattered. He switched the probe to Dylan's ear, a trick for low perfusion. The number steadied briefly, then slipped. Caleb's hand tightened on the bed rail, not from panic, from focus. Around them, the ER continued to roar. Voices, wheels, shouting. The sound of another stretcher hitting the threshold. Dylan's eyes fluttered. "Am I okay?" he whispered. Caleb leaned in close so Dylan could hear him without Caleb raising his voice. "Stay with me," he said. "Keep your eyes open." Jenna returned with a manual cuff and a bag of fluids. She wrapped the cuff around Dylan's arm, pumped, listened with her stethoscope. Her face changed. She looked up at Caleb. "It's 88 systolic." Caleb nodded once. "Hang the fluids, wide open." Jenna's hands moved quickly now, fear turning into action. She spiked the bag open the roller clamp and watched the drip chamber race. Caleb's eyes lifted toward the trauma bays where Vaughn and Marissa were still buried under reds. He did not call out yet. He watched Dylan's face, the breathing, the skin tone, the pulse trend. The monitor beeped again, faster now, as if it had finally decided to speak with urgency. A sharp alarm tone cut through the corridor and nearby heads turned for half a second before snapping back to their own crises. Caleb kept his hand on the rail, steadying the stretcher as if it were a moving vehicle. Dylan's oxygen number dropped 2 points, then 3. Caleb's voice stayed low. "Jenna, get a second line." Jenna swallowed. "Okay." She reached for another catheter. Dylan's eyes rolled slightly, then fought back. "I'm tired," he murmured. Caleb leaned closer. "Don't close them," he said. The alarm sound changed again, the machine escalating, as if it sensed the shift before anyone else would admit it. Caleb looked up toward the charge desk, and his gaze met Luis's from across the room. Luis had seen the monitor. He had heard the tone. Luis stepped away from his station without waiting for someone to ask. Luis stepped away from his station without waiting for someone to ask. He crossed the corridor with the ventilator mask still in his hand, eyes already reading the hallway the way sailors read water. Caleb did not wave him over. He did not need to. The alarms had done that. Luis reached Dylan's stretcher and took in the scene in one sweep. The pallor around Dylan's mouth, the sheen of sweat, the way his breathing had turned shallow as if his lungs were trying to ration air. The oxygen number on the monitor dipped again, then blinked, then dipped harder. Luis leaned close enough to hear Dylan's breath. "He's losing it," he said quietly. Caleb's voice stayed low. "Pressure is dropping. Perfusion is bad. He was yellow 10 minutes ago." Jenna finished taping the second line, hands moving faster now. The manual cuff hung loose at her wrist like a forgotten strap. Luis looked at the pulse ox on Dylan's ear. The waveform was ragged. "Signal is weak," he said. Caleb nodded. "It's not just the probe." Dylan's eyes fluttered. He tried to speak, but the words did not form. His tongue moved, then stopped. A slow panic rose behind his pupils, the animal part of the brain noticing the body slipping away. Caleb leaned in close. "Dylan, breathe in. Good, stay with me." Dylan's chest rose shallowly. The monitor beep sped up, then sharpened into a higher-pitched alarm. The blood pressure reading popped up again on the screen, lower than the manual had been. Jenna stared at it. "He's dropping into the 70s. A nurse, 2 beds down, called out for pain meds. A green, tagged man shouted that his arm was numb. The hallway kept acting like a hallway even as Dylan's stretcher stopped being one. Caleb's hand tightened on the rail. His eyes moved once fast toward the charge desk. Marissa was in the trauma corridor with a marker in her hand, triage tags fluttering. Dr. Vaughn was a blur at the doorway of Trauma 1. Nobody's head turned toward the hallway. Caleb looked back to Dylan. Oxygen, non-rebreather, now. Luis did not hesitate. He placed the mask, opened the flow, and watched the reservoir bag inflate. "Hold still," he told Dylan, voice firm but calm. Dylan's chest rose, then stalled. His mouth opened like he was trying to drink air. The oxygen number fell anyway. Caleb's tone stayed measured. "Jenna, pressure bag on the fluids." Jenna grabbed the pressure infuser Caleb had found earlier and wrapped it around the saline. She pumped until the gauge climbed her forearms, tightening. Caleb reached for Dylan's wrist and checked a pulse that felt thin and fast, like it was trying to run away from his fingers. He glanced at Dylan's abdomen again. Under the blanket, the distension was clearer now. Not dramatic, but wrong. Dylan's eyes rolled slightly. His head turned, and a wet cough rose from his throat. Something bubbled at his lips. Luis cursed under his breath. "He's about to vomit." Caleb's hand moved to Dylan's jaw, turning his head to the side. "Suction," he said. Jenna looked around, eyes wide. "We don't have it here." Luis was already moving. He spun and called toward the respiratory station. "Suction to hallway now." A tech sprinted with a portable suction unit, cords trailing. Caleb kept Dylan's head turned, one hand steady at the jaw, the other braced on the rail to keep the stretcher from shifting as Dylan's body convulsed. Dylan gagged. A dark fluid, spilled out not bright red but brown, tinged the smell sharp and metallic. Jenna flinched, then grabbed gauze and wiped at the corner of Dylan's mouth. Caleb's voice cut through the noise, on his side. "Keep his airway clear." 2 nurses grabbed the sheet and rolled Dylan slightly. The stretcher creaked. Dylan coughed again and the suction arrived just in time. The tech shoved the catheter into Caleb's hand. Caleb suctioned with controlled precision, eyes tracking Dylan's chest rise, the oxygen number, the color at his lips. He did not look frantic. He looked focused. Luis leaned close to Dylan's face, watching for the moment the breathing failed. "He's tiring," Luis said. Caleb nodded. He spoke without raising his volume, and yet people moved. "Bring the crash cart. Bring a blood tubing set. Call Marissa." Jenna swallowed. "We can't start blood without an order." Caleb's eyes stayed on Dylan. "Then call the order in. But we need the equipment here." Jenna hesitated for a fraction. Then she looked at Dylan's face and made a choice. She turned and shouted down the hallway. Crash cart to overflow now. A nurse at the charge desk finally looked up. What's going on? Caleb lifted his voice just enough to carry. Hallway yellow is crashing. That got Marissa's attention. Her head snapped toward the sound eyes, finding Dylan's stretcher in the line of hallway beds. She started moving fast. Dylan's oxygen number dropped into the 80s. His breathing turned irregular, a brief pause between shallow breaths. Luis's voice hardened. He's not moving air, he's losing drive. Caleb leaned in and spoke into Dylan's ear. Stay with me, keep breathing. Dylan's eyes flickered once, then slowed. The panic faded into something worse, a sliding quiet. Caleb looked at Luis, bag him. Luis grabbed the bag valve mask and sealed it over the non-rebreather, switching quickly, hands practiced. He squeezed gently, watching the chest rise. Caleb watched the chest rise too, then the fall. He watched the neck veins. He watched the skin. Jenna returned with the crash cart pushed by a tech whose face was flushed with effort. The cart slammed into place, drawers rattling. Caleb opened the top drawer and pulled out airway adjuncts. He chose an oropharyngeal airway by size and slid it into Dylan's mouth to keep the tongue from collapsing, his motion quick and sure. A nurse stared at him. Are you allowed to do that? Caleb did not answer. He checked Dylan's pupils again, then the pulse, then the blood pressure. The numbers slid lower. Marissa arrived like a storm front, eyes blazing. She took in the scene in one hard look. The crash cart. Luis bagging. Caleb at the bedside with the airway in place. Nurses clustered close, waiting for direction. Marissa's voice snapped. What is this? Caleb did not look up. He dropped pressure. He started vomiting. He's aspirating. Marissa's eyes flashed. Why did nobody call trauma? Caleb's voice stayed level. I called you. Marissa pointed at him sharp. You were assigned overflow. You do not run a resuscitation in the hallway. Caleb kept his hand on Dylan's wrist, counting the thin pulse. He was dying. Marissa's jaw flexed. She looked to Jenna. Who started this? Jenna's voice shook. He told us what to do. The patient crashed. Marissa's eyes locked on Caleb again. Heart, step back. Caleb did not step back. He did not flare up either. He simply continued watching Dylan's face and the monitor, listening to Luis's bagging rhythm. Marissa moved closer. Voice lower, more dangerous. Step back now. Caleb finally lifted his gaze to her, calm and unblinking. If I step back, who's watching his airway? Luis looked up briefly, still bagging. His eyes met Marissa's, and he did not look away. Marissa's throat worked as if she swallowed a curse. She turned toward the trauma corridor and shouted, Doctor! Dr. Vaughn's name did not matter. His rank did. People called for rank when fear sharpened. The seconds stretched. Dylan's oxygen stayed low despite bagging. His blood pressure hovered at a number that did not promise survival. Caleb watched for the signs of shock, deepening skin mottling spreading to the edges of Dylan's hands. Marissa grabbed a radio and spoke into it. Vaughn, I need you in overflow. Yellow turned red. Vaughn's voice came back clipped. I'm in trauma 1 with a pelvic bleed. Marissa's tone turned icy. Then send someone. He is crashing in the hallway. A pause. The kind that meant Vaughn was deciding which life to prioritize without saying it out loud. Fine, Vaughn's voice snapped. 2 minutes. Marissa glared at Caleb. 2 minutes. You could have waited. Caleb's eyes flicked back to Dylan. 2 minutes is a long time without a blood pressure. Marissa's nostrils flared. You want to debate policy in the middle of this? Caleb's voice remained steady, almost quiet. I want him to live. Marissa's face hardened. Then, do your job and let me do mine. She reached for the crash cart and pulled out a bag of normal saline, checked the rate, then looked at Jenna. Get me a manual pressure every minute. Jenna nodded, pumping the cuff, listening, calling out numbers that slid downward. Luis kept bagging, careful not to overinflate. He needs suction again, Luis said. Caleb grabbed the suction catheter and cleared the airway again, then checked breath sounds quickly. The right side sounded diminished, but the whole picture was muddy in the hallway chaos. Aspiration, poor perfusion. Shock. Caleb's mind tracked possibilities like a grid. Marissa watched his hands and saw the competence she had been avoiding naming. That recognition did not soften her. It made her angrier because it meant her earlier choices had consequences. A resident arrived, breathless, sent by Vaughn. He was young eyes wide. "What's the situation?" Marissa answered before Caleb could. Hypotension, possible aspiration deteriorating, mental status. He needs a bay. The resident glanced at Dylan's abdomen and the distension. Could be internal bleeding. Caleb spoke still calm. He had seatbelt trauma. Belly is distending. He's dropping despite fluids. The resident's eyes snapped to Caleb, surprised by the clarity. "Who are you?" his nurse Caleb said. The resident looked to Marissa. "We need fast ultrasound." Marissa's mouth tightened. "All ultrasound is in trauma 1 and 2. The resident looked toward the trauma corridor as if he could will equipment to appear. He turned back. "Then we move him." Marissa nodded sharply. "We move him." 2 techs grabbed the stretcher. The wheels unlocked. Dylan's body shifted, and his oxygen dipped further as the bag valve mask seal loosened. Luis tightened his grip. "Hold still," he snapped, not to Dylan, to the stretcher, to the world. Caleb climbed to the side of the gurney as it started rolling. He kept one hand on the rail, the other steadying the airway eyes on Dylan's chest rise. Marissa walked beside them, radio in hand. "Clear a bay, now." They pushed into the trauma corridor. The sound changed instantly. Louder, sharper, more compressed. A trauma bay door opened, and a nurse stepped out, blood on her gloves. Marissa pointed. "That one. We take it." The nurse frowned. "We're turning it for the next red." Marissa's voice did not budge. "This is red." The nurse's eyes flicked to Dylan's face and the bagging. She stepped aside. They rolled Dylan into the bay. The monitors beeped in a new pitch, a new space, a new level of attention. A nurse slapped new leads on Dylan's chest. Jenna hung another bag of fluid. The resident grabbed an ultrasound probe from a tray and looked around like he expected someone to stop him. Marissa's gaze landed on Caleb. "Out." Caleb paused. Not because he wanted to argue, but because Dylan's head lolled and the mask seal threatened to slip. Luis looked at Caleb and then at Marissa. "He's keeping the airway stable," Luis said. Marissa's eyes narrowed. "Luis, do not join him." Luis kept bagging. "I'm joining the patient." Marissa's jaw tightened. "Fine, but the attending is coming." Hart, step aside. Caleb eased back half a step, but stayed close enough to correct the airway if needed. His eyes remained on Dylan, not on Marissa. Vaughn arrived seconds later, coat streaked with blood gloves snapping on as he stepped into the bay. His eyes cut to the monitor, then the distended abdomen, then the bagging. "What happened?" he demanded. Marissa answered, voice clipped. He was yellow in the hall. Hart initiated resuscitation. He's hypotensive and aspirating. Vaughn's gaze snapped to Caleb. Irritation flared. "You started this." Caleb's voice stayed level. He crashed. Pressure dropped. He vomited. "We supported airway and fluids." Vaughn's nostrils flared. "You do not initiate interventions beyond your role." Caleb held his gaze without challenge. "I initiated the ones that kept him alive." Vaughn's face tightened as if he had been insulted. "Are you giving orders in my department now?" Caleb did not raise his voice. "I'm giving care." Vaughn turned to the resident, fast. The resident placed the probe on Dylan's abdomen gel, spreading cold. The screen flickered into grayscale shapes. The resident's face changed as he found the pocket of fluid where it did not belong. "Free fluid," the resident said, voice tight. "Likely bleed." Vaughn's irritation shifted, not disappearing, but rerouting into action. "Get surgery. Massive transfusion now." "Oh, negative." A nurse moved. Another grabbed blood tubing. The room accelerated. Caleb watched Vaughn's hands move toward the phone. He watched the chain of command catch up to the reality that had already happened. Marissa stepped close to Caleb, voice low. "You had no order." Caleb looked at Dylan, then back at Marissa. He had no time. Marissa's eyes glinted with frustration. You think I don't know that? You think I like rules right now? But when administration asks why a nurse started a resuscitation, they don't ask the airway. They ask the name. Caleb's expression did not change, but his tone sharpened slightly. Then use my name. Marissa stared at him as if that answer did not fit the box she wanted him in. Vaughn turned back, gaze landing on Caleb again. Out of my bay, he said. Now. Caleb stepped back. He did it cleanly without drama. Luis stayed at the head of the bed bagging until Vaughn's intubation equipment arrived and the airway could be secured more permanently. As Caleb moved out into the corridor, the sounds followed him. The suction, the beeps, the rushed footsteps. He walked back toward overflow with the same steady pace he had kept all night, but the air around him felt different now. People's eyes followed him not with warmth, but with awareness. Jenna caught up beside him breathless. You saved him. Caleb did not look at her. We kept him alive. Jenna's voice trembled. Marissa is going to write you up. Caleb's tone stayed even. Then she will. Jenna shook her head as if trying to understand how someone could accept that so calmly. How are you not angry? Caleb glanced at her once. I'm busy. He returned to overflow and saw that nothing had paused for the resuscitation. The hallway was still lined with stretchers. The waiting room was still full. Another ambulance had arrived. The department did not care that one man had almost died. It only cared that more people were arriving who might. Luis's station was momentarily empty. A new respiratory tech hovered near it, uncertain hands twisting at the edge of a clipboard. Caleb moved past without stopping, eyes scanning monitors as he went. Savannah. The young woman who had been panicking earlier sat in her chair with her hands folded tightly in her lap. Her breathing was steadier now, but her eyes were fixed on the trauma corridor as if she could see through walls. She saw Caleb return and grabbed his sleeve. Her fingers were cold. Is it bad? She asked, voice small. Caleb looked down at her hand, then at her face. It's busy, he said. Savannah swallowed. I keep hearing screaming. Caleb's voice remained calm. People are hurt. We're working. Savannah's mouth tightened. I can't stop shaking again. Caleb watched her for a beat and noticed something beyond anxiety. Her breathing pattern had changed. It was shallower again, but not fast. Her lips were slightly pale. Her hand was not only cold, it was clammy. He reached for her wrist and felt the pulse. It was fast, but not wildly. He looked at her chest rise. He looked at the way she held her ribs when she inhaled a protective brace. Where does it hurt? He asked. Savannah blinked, confused by the shift. My side, right here. She pressed her hand under her right rib cage. Caleb's eyes narrowed. Did you hit the door? I think so, she whispered. It was all spinning. Caleb checked her oxygen again. It had been normal earlier. Now it was slipping slow quiet. 95, 93, 92. He placed a hand gently on her shoulder. I need you on a stretcher, he said. Savannah's fear flared. Why? Caleb kept his tone steady. Because you're working harder to breathe than you were. Savannah's eyes widened. I told them I was fine. Caleb nodded once. People say that when they are scared. He guided her carefully to an open hallway stretcher. A tech tried to protest, pointing at the flowboard. She's green. Caleb's gaze cut to the tech, calm but firm. She's changing. The tech hesitated, then helped. Caleb attached the monitor leads himself. The heart rate came up high. The oxygen number continued to drift down. Savannah's voice shook. I don't want to be alone. Caleb looked at her and saw the tremor in her hands, the dust still clinging to her hairline, the way her body was trying to keep up with an injury it had not yet understood. You're not alone, he said. Look at me. Savannah locked eyes with him. Tell me if it gets worse, he said. If you feel dizzy, if your chest tightens, if your breathing changes, you tell me. Savannah nodded quickly, tears threatening. Okay. Caleb palpated gently along her ribs, watching her face for the flinch. She winced sharply at one point near the lower ribs. He listened to her lungs. The right side sounded a little quieter than the left, not absent, but reduced. A nurse approached clipboard in hand. "Do you have orders for her?" Caleb looked up. "She needs a provider assessment. Breath sounds reduced on the right. O2 dropping." The nurse frowned. "They're slammed." Caleb's voice remained calm, then put her on the list at the top. The nurse stared at him for a second, then nodded and moved toward the charge desk. Across the corridor, Marissa reappeared, face-tight eyes scanning. She saw Caleb at Savannah's stretcher. She saw the monitor numbers. Her expression hardened again, equal parts frustration and fatigue. "What are you doing now?" she demanded. Caleb did not stand up straight to meet her. He stayed at Savannah's level hand on the bed rail. "She's decompensating," he said. "Her oxygen is dropping. Breath sounds reduced on the right. She needs evaluation." Marissa's eyes flashed. "Heart, do not create new problems for me." Caleb's gaze held steady. "This problem already exists." Marissa's jaw worked. She looked around as if searching for a doctor, but the trauma corridor swallowed everyone with authority. Her shoulders rose with the weight of responsibility and the fear of missing something. She hated that Caleb kept finding the things the system missed. Savannah's oxygen dipped again, and the monitor chirped not an alarm yet, but a warning. Caleb reached for oxygen tubing and placed a nasal cannula, then increased the flow. The oxygen number stabilized slightly, still low, but less sliding. Marissa watched him and spoke through clenched teeth. "You like stepping into places you don't belong." Caleb's voice stayed level. "I like patients who keep breathing." Marissa's eyes sharpened at that. She looked like she wanted to snap back, but a nurse shouted from the trauma corridor, "Marissa, I need you." "We're out of blood tubing." Marissa turned, then stopped, gaze still on Caleb. For a beat, the charge nurse looked like a person, not a title. Her exhaustion showed in the lines at the corner of her mouth. "Stay in overflow," she said, voice lower now. "Do not go into my bays." Caleb nodded once. "I'm in overflow." Marissa turned and disappeared into the corridor again. Caleb stayed with Savannah long enough to see her breathing settle under oxygen support, then moved down the line of hallway beds. He checked another patient's IV site and found infiltration fluid swelling beneath the skin instead of into the vein. He stopped it, restarted the line higher up, taped it down with careful hands. He adjusted a monitor lead again, silencing a false alarm. He guided a new nurse through a medication check without humiliating her. He did not make a show of it. He simply kept the system from bleeding out through small failures. Luis returned from Trauma 1, gloves discarded, face damp with sweat. He stepped into overflow and paused, eyes landing on Caleb, then Savannah's monitor, then the line of patients. Luis spoke quietly, so only Caleb could hear. "He's going to surgery." Caleb nodded once. "Good." Luis watched him for a moment. "They're mad at you." Caleb's eyes stayed on the monitors. "They're alive." Luis exhaled slow. "That's the point." A scream cut through the waiting room, sharp and sudden. A nurse sprinted toward the entrance with a wheelchair. The automatic doors opened again, letting in a gust of dusty air and the sound of another siren fading as it stopped. An EMT pushed in a stretcher and shouted over the noise. "Incoming pediatric. 8-year-old male. Unresponsive for moments. Vitals unstable." The ER shifted around the word pediatric, heads turning, bodies moving, the corridor tightening as staff made space. Caleb's gaze lifted toward the doors, and his posture changed in a way that was almost too subtle to notice. An EMT pushed in a stretcher and shouted over the noise. "Incoming pediatric. 8-year-old male. Unresponsive for moments. Vitals unstable." The ER shifted around the word pediatric, heads turning, bodies moving, the corridor tightening as staff made space. Caleb's gaze lifted toward the doors, and his posture changed in a way that was almost too subtle to notice. His shoulders squared, not with pride, with readiness. The stretcher rolled under the fluorescent lights and the boy looked too small for the chaos around him. Dust clung to his eyelashes. A thin line of blood traced from one nostril to his upper lip. His chest rose in quick, uneven bursts that made his ribs show. One sneaker was missing. The other hung half on laces, dragging. The paramedic at the rail spoke fast, each word clipped by urgency. Name's Mason. Found restrained in back seat. Vehicle was pinned. He had a period of altered responsiveness. B, P90/50 when we loaded. Heart rate 150. He keeps trying to drift off. Abdomen tender, bruising across the belt line. We gave 500 fluid. Pressure came up to 98, then slid again. Marissa met them at the threshold of the trauma corridor and drew a red mark on the tag without hesitation. Trauma 1 is occupied, she called. Trauma 2 is PED's female. Bring him to Trauma 3. A nurse blinked. Trauma 3 is a storage bay. Marissa's eyes were hard. Not tonight. They pushed into the bay that had been cleared by force supply carts, shoved against a wall, a trash bin, kicked aside. A tech slapped a monitor lead onto the boy's chest. The adhesive barely stuck through the dust. A nurse wiped the skin and pressed again. Mason's eyes fluttered open, unfocused. He looked at the ceiling, then at Marissa's face, then away, as if the effort of seeing hurt. His lips parted, and a small sound came out, more breath than voice. "My mom," he whispered. The words cut through the noise in a way no alarm could. A resident froze mid-motion, and the nurse holding an IV catheter swallowed hard. Marissa leaned close, voice firm but softened by necessity. "We are taking care of you." "You hear me, Mason?" Mason's eyes moved toward her, then drifted. His hand twitched against the sheet like he was trying to reach for something that was not there. Dr. Vaughn appeared in the doorway, with blood on his sleeves and fatigue in the set of his mouth. He stepped in like the room was his, and everyone's body responded the way bodies do around a person who makes final calls. "Give me a rundown," Vaughn snapped. The paramedic answered. 8-year-old male. Seatbelt sign. Tachy hypotensive. Altered intermittently. Abdominal tenderness. Possible internal injury. Vaughn looked at the bruising across Mason's abdomen, a dark band starting to bloom under the skin. His eyes flicked to the monitor. Heart rate 157. Blood pressure 92/48. Oxygen 94 on nasal cannula. Access, Vaughn ordered. 2 large bore, type and cross. Get CT ready. Marissa stepped to the foot of the bed marker still in her hand. "He's not stable for CT," she said. Vaughn's head snapped toward her. "We do not guess on a child." Marissa's voice stayed level, but her jaw flexed. "We do not drag an unstable kid into a hallway and pretend a scanner is a life support machine." A resident hovered at the side with a catheter, hands shaking. "I can't get it," she admitted, voice tight. Marissa's eyes cut toward her. "Then you move, and someone who can does." The resident stepped back, cheeks flushing with shame and fear. Another nurse reached in, found the vein missed, tried again, missed again. Mason's skin was cool, veins collapsed the body, already pulling blood toward the core. Caleb stepped into the doorway and stopped as if an invisible line held him. He was still assigned to overflow. Marissa had said it twice, as if repetition could make the rules stronger than the night. Vaughn saw him and his expression tightened. "Why are you here?" Caleb's voice was calm. "PEDS is unstable. You need hands." Vaughn's eyes narrowed. "I did not call you." Marissa looked over her shoulder at Caleb. Her face was hard and exhausted. "Heart, go back." Caleb did not move. He did not step closer either. He stood at the threshold, eyes on Mason's chest rise on the monitor trend on the way the child's lips were paling. Luis arrived behind Caleb, oxygen bag in hand, gaze sweeping the room. He stopped when he saw Mason. His face changed, not dramatically, just enough. "His breathing's getting shallow," Luis said. Vaughn pointed without looking away from the child. "You." Get ready for airway. Luis moved in placing equipment with quick hands. A nurse finally secured an IV line tape pressed tight. Blood flashed in the chamber. Good, Vaughn said. Draw labs, start fluids, get him to CT. Mason's eyes fluttered open again. He turned his head slightly and grimaced. A small whimper escaped, and his hand curled into the sheet. Caleb watched the way Mason moved. Not random. Guarding. Protecting the belly. He watched the pulse pressure narrow on the monitor, the top number holding while the bottom climbed. He watched the skin modeling start at the knees. Marissa noticed his focus and her irritation sharpened again. Heart, she said, warning in her tone. Caleb spoke anyway, still quiet. Seatbelt sign plus hypotension plus altered, that is internal bleed until proven otherwise. Vaughn's head turned slowly, eyes locking on Caleb. You are not diagnosing. Caleb's gaze stayed on Mason. I'm not diagnosing, I'm seeing the trend. Vaughn stepped closer, voice edged with authority. You are a nurse in overflow. You do not tell me how to run my trauma. Marissa stepped between them slightly, not protecting Caleb, protecting the bay from turning into a fight. We can debate later. He needs a decision. Vaughn pointed at the resident. Get transport ready. We go to CT. Luis leaned in toward Vaughn, voice low. Doctor, he's compensating hard. He's going to tire. If we move him and he crashes in the corridor, we are bagging in the elevator. Vaughn's jaw tightened. He hated being boxed in by reality again. Mason's blood pressure dipped. 88/42. A nurse read it aloud, voice strained. 88. Marissa looked at Vaughn, eyes unblinking. He is telling you. Vaughn's eyes flicked to the bruise across Mason's abdomen again. He pressed 2 fingers gently into the skin, and Mason gasped a sharp involuntary sound. The abdomen tightened like a shield. Vaughn pulled his hand back. Fast ultrasound, he snapped. Now. A resident grabbed the ultrasound machine, wheels squealing. The probe landed on Mason's belly gel, cold. Mason flinched. The screen filled with gray and black shapes that took training to read. The resident's eyes darted uncertain. Marissa leaned in. Do you see fluid? The resident swallowed. I'm not sure. Vaughn grabbed the probe from the resident's hand with a controlled impatience and moved it himself, angle shifting by degrees. His face went still. The monitor showed a dark pocket where it did not belong. Free fluid. Vaughn's nostrils flared. He looked up, eyes hard. Surgery. Now. Marissa did not react with triumph. She reacted with motion. Call trauma surgery. Massive transfusion. Get an OR runner. Get blood. A nurse hesitated. He's a child. Do we start blood in the bay? Vaughn's voice cut. Yes. The room moved. Caleb stepped 1 pace closer, not into the center, just close enough to be useful. His voice stayed even. He needs warming. He's cold. Hypothermia will worsen bleeding. Marissa's eyes flicked to him, irritation warring with the fact that he was right. Get a warmer, she barked, and a tech ran. Vaughn turned to Caleb. You want to be helpful. Go back to overflow. Caleb held Vaughn's gaze for a beat. He's going to crash on the way if you do not stabilize first. Vaughn's mouth tightened. We are stabilizing. Caleb's voice stayed low. Stabilize on wheels. Not after the elevator. Marissa looked sharply at Caleb. Heart. Caleb spoke again, not louder, just firmer. His pressure is dropping. His mental status is fading. He is still breathing on his own, but he is tiring. If he loses drive mid-transport, we lose time. Luis glanced at Caleb, then back to Mason's chest rise. He's right, Luis said quietly. His rate is dropping. He's not getting better. Vaughn's eyes snapped to Luis. Stay in your lane. Luis did not flinch. My lane is air. Mason's eyes fluttered open, and he looked at Vaughn with a child's raw fear. The kind that has no filter. It hurts, he whispered. Marissa leaned close to the boy. I know. We are going to help you. Mason's hand twitched again, searching. His voice cracked. My mom. Marissa's throat worked. She looked at the unit secretary through the open door. Find his parent, now. The secretary nodded and started typing, eyes wide. Vaughn looked at the monitor again. 84 systolic. He exhaled sharply through his nose. Prepare to intubate, he said, and the room tightened. Marissa's eyes snapped up. You sedate him and you drop him. Vaughn's face hardened. You want him to crash without an airway? Marissa stepped closer. You want him to crash because you pushed meds into a child with empty veins. The argument sharpened again, the same pattern as before, the same collision between urgency and protocol, between risk and control. Caleb's voice cut through it, quiet but precise. Do not fully sedate. Assist ventilation first. Give small doses. Keep spontaneous breathing if possible. Every head turned toward him. The bay held still for half a second, the way a room stills when an unexpected voice lands on something true. Vaughn's eyes narrowed. You think you can direct anesthesia now, too. Caleb did not blink. I think a child in hemorrhagic shock does not tolerate a full induction. A nurse stared at Caleb like she wanted to ask why a quiet overflow nurse sounded like he had stood next to worse than this. Marissa's gaze stayed on Caleb's face, and for the first time her anger faltered into something else. Calculation. Not trust yet, but recognition. Vaughn looked back at Mason. The boy's breathing was slowing, each breath a heavier effort. His lips were pale. His fingers curled and uncurling, a small sign of the body fighting to stay awake. Vaughn made a decision without admitting it came from anywhere but his own mind. Luis, assist ventilation with bag. No meds yet. Keep him breathing. Luis moved immediately, mask placed gently. He squeezed the bag with care, watching the chest rise. Mason's eyes fluttered and he grimaced, but the oxygen number stopped slipping. Marissa leaned in. Get blood here now. Warmed. A nurse ran to the cooler. Caleb stepped to the head of the bed close to Luis, but not crowding. He watched the SEAL adjusted the mask angle with 2 fingers, and the chest rise improved. Luis glanced at him once, a silent acknowledgement. Mason's blood pressure ticked up by a few points as fluids and blood began to enter. Not saved, not safe, just held. A stretcher appeared at the doorway with transport staff, eyes anxious. We go. Marissa looked at the monitor. Not yet. Vaughn snapped. We go now. Caleb spoke quietly. Give it 1 minute. 1 minute to fill the tank. Vaughn's eyes flashed. You do not negotiate my time. Caleb's gaze stayed fixed on Mason. His body is negotiating it for you. The blood pressure reading popped again. 88, 90. Marissa pointed. Now. They moved. The gurney rolled out Luis at the head with the bag. Marissa at the side, holding the bloodline steady. Vaughn walking fast, eyes on the monitor, one hand on the rail. Caleb walked beside the foot, not asked, not invited, but there keeping cables from tangling, clearing a path with his body. A nurse in the corridor tried to stop him. Hart, where are you going? Caleb did not look away from the gurney, keeping him stable. The corridor was a tunnel of sound. Wheels squealed. Someone yelled for a room. Someone cried in the waiting room. The elevator doors slid open and the gurney rolled in, barely fitting. Inside the elevator, the air felt too small. Mason's eyes fluttered open again and he looked at the ceiling, then at Marissa, then at Caleb. His lips moved. Caleb leaned close, voice low enough to cut through the elevator hum. Stay with me, Mason. Mason's hand twitched toward Caleb's sleeve. His fingers brushed fabric, then fell. The blood pressure dipped again as the elevator rose. Vaughn's jaw clenched. He looked at the monitor, then at Luis's hands. Bag slower, Vaughn snapped. Don't overventilate. Luis's voice stayed calm. I'm watching his rise. Caleb watched Mason's face, the slight slackening around his eyes that signaled fatigue turning into surrender. He put 2 fingers gently at Mason's jaw and lifted slightly, keeping the airway open while the mask did its work. The elevator dinged. Doors opened to a sterile hallway that felt like another universe, quieter, colder. OR staff waited with a transport stretcher and wide eyes. A surgeon in scrubs approached, gloved hands already moving. "What have we got?" Vaughn spoke fast. 8-year-old male suspected abdominal bleed-free fluid on fast, unstable vitals transfusion started. The surgeon's gaze flicked to the monitor, then to the bruise across the belly. "We take him." Marissa held the bloodline while they transferred Mason to the OR stretcher. Luis kept the mask sealed until the anesthesiologist took position. Caleb stepped back as the OR doors swung open. The boy disappeared into the bright interior like a small boat pulled into a storm. For a beat, the hallway went still. Marissa exhaled, long and controlled, then looked at Vaughn. "If you had pushed him to CT first," she said quietly. Vaughn cut her off. "Enough." Marissa's eyes slid to Caleb. Caleb's face was blank, but his hands were slightly flexed as if they still felt the gurney rail. Vaughan's gaze followed hers, and his irritation returned a familiar shield. "You," he said to Caleb, "you were told to stay in overflow." Caleb met his eyes. "I stayed with the patient." Vaughn stepped closer, voice low but sharp. "You challenged me in my bay." Caleb did not raise his voice. "I challenged the delay." Vaughn's nostrils flared. "You have no idea what you risk when you undercut chain of command." Caleb's tone stayed even. "I know what it costs when nobody speaks." The hallway felt colder for a second. Marissa's mouth tightened. She looked away, as if the words hit something she did not want touched. Vaughn stared at Caleb, then turned abruptly and walked back toward the elevator, coat swinging. "Go back to your assignment," he snapped without looking back. Marissa lingered half a second longer. Her eyes stayed on Caleb's face. "Overflow," she said quieter than before. Caleb nodded once and turned. The elevator ride down felt longer, without the gurney, without the monitors beeping to anchor every second. When the doors opened back into the ER, the noise hit him again like heat. The department had not paused for Mason. It had simply absorbed him and kept moving. A nurse rushed past with a blood cooler. Another pushed a cart of meds. The waiting room was still full. A man stood at the counter yelling that his wife had been forgotten. The unit secretary's voice rose, then cracked, then steadied. Caleb moved back into overflow and found Savannah still on oxygen, eyes fixed on the trauma corridor. Her breathing was slightly easier now, but her color remained pale. She saw Caleb and her face tightened with fear. "Is it worse?" she asked. Caleb checked her monitor, then her chest rise. "It's busy," he said again, because it was the truth that mattered. Savannah swallowed. "I keep thinking my car is still spinning." Caleb's gaze stayed steady. "You're here. You're on a bed. You're breathing." Savannah's fingers gripped the sheet. "I don't feel safe." Caleb did not offer comfort that sounded like a speech. He adjusted her oxygen flow and watched the number climb a fraction. "We keep you stable," he said. "That's how you get safe." Savannah nodded, tears slipping into her hairline. Luis returned to overflow a few minutes later, face drawn with fatigue. He stopped beside Caleb without speaking for a moment, eyes scanning the corridor the way he always did. Caleb did not speak either. The quiet between them was not awkward, it was functional. Luis finally said that kid was close. Caleb's eyes stayed on Savannah's breathing. "Yes." Luis watched Caleb's hands, the way they moved with economy, the way he checked lines and monitor, as if he could feel them failing before they did. "You don't move like someone trained in a hospital," Luis said. Caleb's jaw tightened slightly. "I move like someone trying not to waste time." Luis's gaze held. "No, it's more than that." A call bell rang. A nurse shouted for help in the hallway. Caleb stepped away, fixed an infiltrated IV, restarted it without drama, then returned. Luis was still there. "You knew when to wait," Luis said quietly. "And you knew when waiting was a lie." Caleb did not answer. Luis leaned closer, voice lower. "I've worked with vets. I've worked with flight medics. I've seen that calm when people are bleeding and everyone else is yelling." Caleb stared at the floor for a beat, like he was deciding whether words were worth the cost. A brief lull came, not silence, just a thinning in the rush. The sirens outside were less constant. The trauma corridor still moved, but the screams had become fewer, replaced by hurried footsteps and clipped orders. Marissa appeared at the charge desk, shoulders slumped for the first time all night. She drank water like it was medicine, then set the bottle down with a hand that trembled once before steadying. Vaughn passed through coat-changed hair, slightly disheveled eyes hard with exhaustion. He did not look at Caleb. Caleb turned towards the supply room, needing gloves, tubing anything that would keep him busy in a way that did not involve thinking. He stepped inside, and the room was tight shelves packed to the air cooler. The door muffled the ER noise into a distant roar. He pulled open a drawer and took out a box of gloves. His hands moved with the same precision as always, but his eyes were not on the gloves. They were on nothing. Luis stepped in behind him and closed the door most of the way, leaving it cracked. The hum of the fluorescent bulb overhead filled the small space. "I've been watching you," Luis said. Caleb did not look up. "You should watch your vents." Luis's voice stayed steady. "I can do both." Caleb slid a box of gloves onto his cart. "We're short on supplies." Luis leaned against a shelf, arms folded. "We're short on a lot." Caleb's fingers paused on a coil of tubing. He looked up at Luis, expression guarded. "What do you want?" Luis held his gaze. "Where did you learn to move like that under pressure?" Caleb's eyes narrowed slightly. "Here." Luis shook his head once. "No, not in 3 months, not in any hospital, not like that." Caleb's jaw flexed. He looked down again, the silence stretching. Luis did not fill it with more questions. He waited the way you wait when you know pushing will only lock the door. Caleb finally spoke, voice low. It was a different kind of ER. Luis's expression did not change, but his eyes sharpened. "Military." Caleb's hands tightened on the cart handle. "Army." Luis's breath left him slowly. "Combat medic." Caleb nodded once. Luis stared for a moment, the pieces sliding into place in his mind. The calm, the speed, the refusal to waste breath on ego, the way Caleb's voice carried without rising. "How long?" Luis asked. Caleb's gaze drifted to the shelves, to the labels, to the order of things. "Long enough." Luis's voice softened slightly. "Not pity, respect. That's why you stay quiet." Caleb's eyes met his. "Quiet keeps people from looking at you. Looking turns into questions. Questions turn into stories." Luis nodded slowly. "And you don't want the story." Caleb's face stayed controlled, but something deep under it tightened. "I want the work." The intercom crackled overhead, sudden and sharp in the small room. A voice from administration, formal and tight, cut through the night's grime. "Charge Nurse Klein and attending physician Vaughn report to conference room B for immediate incident review." Caleb and Luis held each other's gaze for a beat. The hum of the bulb overhead seemed louder. Caleb picked up the gloves and set them on the cart. His hands did not shake. He opened the supply room door, and the ER sound rushed back in relentless reel. The supply room door swung open, and the ER noise rushed back in relentless and bright. Caleb pushed his cart into the corridor and let the sound swallow him. Phones rang. A patient shouted for a blanket. Wheels squealed as a stretcher clipped the corner of a doorway. The air carried dust and sweat and antiseptic layered into something that clung to the back of the throat. Marissa Klein strode past the charge desk with her radio still in hand, shoulders squared like she could hold the whole department upright by force. Dr. Spencer Vaughn followed a step behind, jaw-tight eyes fixed forward. Neither of them looked at the people they passed. They moved with the hard focus of leaders walking into judgment, not because they feared being wrong, but because they hated being measured. Luis Navarro watched them go from the respiratory station. He did not speak. He did not have to. The overhead call had already shifted the temperature in the room. Nurses glanced at each other, then back to their tasks. Residents checked charts with more urgency. The department kept moving, but the pulse underneath it changed like a muscle tightening before impact. Caleb turned back to overflow and found Savannah still on oxygenized glassy fingers gripping the sheet. Her breathing was less frantic now, but each inhale carried a guarded hitch. He checked her saturation again. It had stabilized, yet the right side of her chest still sounded quieter. A provider finally reached her bed, a tired-looking physician assistant with hair escaping her bun and a pen tucked behind one ear. She took one look at Savannah's face, one look at the monitor, and reached for her stethoscope. "Tell me where it hurts," she said. Savannah pointed beneath her right ribs, voice shaking. "Here, and I can't get a full breath." The provider listened to her lungs, brow furrowing. "Get a portable chest film," she called out. "Now." A tech nodded and hurried away. Savannah's eyes darted to Caleb. "Am I going to pass out?" she whispered. Caleb met her gaze. "Stay with your breathing," he said. "In through your nose, slow out." She tried. The oxygen tubing trembled against her cheek. The portable X-ray unit arrived, and the tech worked quickly, sliding the plate behind Savannah with practiced care. The provider leaned close to the monitor, watching the numbers, watching the trend, then watched Savannah's chest rise again. When the image popped onto the screen a minute later, the provider's expression tightened. "Small pneumothorax," she said, voice flat. "Right side, that explains it." Savannah's eyes widened. "What does that mean?" "It means air got where it should not be," the provider said. "It can worsen. We are going to treat it." She looked toward the corridor and raised her voice. "I need respiratory and a doctor for a chest tube kit." Savannah's fear surged. Her fingers clenched harder. Caleb leaned in. "Listen to her," he said quietly. "She found it. You did the right thing coming here." Savannah's eyes filled. "I didn't know." "Oh." "Most people don't," Caleb said. "That's why we watch." Louise arrived a moment later with a kit face, drawn but steady. He checked Savannah's oxygen and listened to her lungs himself, then nodded once toward the provider. "Good catch," he said. The provider glanced at Caleb as if she had just realized who had been sitting with Savannah all along. "You were watching her." Caleb kept his voice even. She changed. The provider nodded, not wasting time on praise. "Stay. Help them set up." Caleb did guiding Savannah through slow breaths while Louise prepped equipment, and the provider called for a supervising physician. The ER swallowed another potential disaster without ceremony. The way it swallowed everything quietly, one crisis at a time. Across the department, a nurse called out that Mason's mother had arrived. Her voice carried down the corridor, raw with strain. "Where is he?" the woman cried. "Where is my son?" Security guided her toward a family room, and Marissa's absence left the task to a social worker with trembling hands. The mother's voice faded into muffled sobs behind a closed door, a sound that did not stop the monitors from beeping or the stretchers from rolling. Caleb's eyes flicked toward the family room door, then back to Savannah. He kept his posture steady. He kept his hands moving. The ER did not allow people to stand still for long. In conference room B, the air felt colder than the rest of the hospital. The fluorescent lights were softer here, filtered through panels that made the room look calm even when it was not. A long table sat under a mounted screen. Administrators filled the seats with pressed shirts and clipped expressions. The hospital's nursing supervisor sat with a laptop open, fingers poised. Risk management was there too, a woman with a neat folder and an unreadable face. Marissa walked in first and stopped just inside the doorway, shoulders still squared. Vaughn entered behind her white coat, swapped for a clean one, as if fabric could separate him from the blood. The door closed with a soft click that sounded too final. A man at the head of the table nodded once. "Charge Nurse Klein, Dr. Vaughn. Thank you for coming." Marissa did not sit until she was told. Vaughn sat immediately back straight, hands folded, gaze hard. The screen lit up with graphs and timestamps the night translated into lines and numbers. Patient arrival times, triage categories, time to intervention, escalation rates. A chart displayed how often alarms were triggered and how often they were resolved without a physician order. Another chart showed medication errors caught before administration logged as near misses rather than events. The man tapped the table lightly. This was an unusually high-volume shift, he said, and an unusually low complication rate. Vaughn's eyes narrowed. That is what you want. It is, the man said, but we need to understand why it happened the way it did. The nursing supervisor scrolled and pointed to a section of the data. There are multiple instances where stabilization occurred outside designated trauma bays, in hallways, in overflow. That is not standard. Marissa's jaw flexed. Nothing about tonight was standard. Risk management spoke voice-controlled. We are not here to argue reality. We are here to document decisions and ensure the department is protected. Vaughn leaned forward slightly. Then document that we made calls under mass casualty conditions. The man at the head of the table nodded. We will. But there is another pattern. He clicked a remote and a new slide appeared. Names were redacted, but timestamps aligned in a clear chain. A set of interventions repeated consistent in sequence. Monitoring adjustments, early oxygen support, line corrections, dose verifications. The same staff ID logged again and again, not in the spotlight but under the surface woven into the outcomes like thread. Marissa stared at the screen. Her fingers tapped once against her thigh, then stopped. Vaughn's expression tightened. He saw it too, the same name attached to the quiet stabilizations and the fast corrections. He hated the feeling of his assumptions unraveling in front of strangers. The nursing supervisor turned her laptop slightly. Who is Nurse Hart on your shift? Marissa's throat worked. Caleb Hart. New to ER, assigned overflow. Risk management flipped open the folder. There was a documented escalation in hallway overflow. A patient triaged yellow decompensated rapidly and was moved to a trauma bay. The chart shows early airway support and pre-arrival interventions initiated by Nurse Hart. Vaughn's eyes flashed. That is precisely my concern. That is not within his scope. Marissa's voice sharpened. And if he had waited for scope, the patient would have aspirated and died in the hall. Silence settled over the table for a moment. Administrators exchanged glances that were not sympathy, not anger, something closer to calculation. The man at the head of the table asked, "Did you authorize his actions?" Marissa held his gaze. "I did not have time to authorize anything. I had 2 trauma bays full and ambulances lined up outside." Vaughn's jaw clenched. This is becoming an issue of insubordination. Risk management tilted her head. Or it is an issue of a unit functioning through unofficial leadership when official leadership was overloaded. Vaughn's eyes narrowed further. That is not how hospitals work. The man's tone remained calm. Hospitals work the way they work under pressure. The question is whether we can explain it and whether we need to correct it. Marissa's hands tightened in her lap. The memory of Dylan's gray lips and the suction catheter came back with a clarity that had nothing to do with charts. The nursing supervisor spoke again. "We are requesting Nurse Hart to join this review." Vaughn's head snapped up. "Absolutely not. He is a staff nurse. This is a physician and charge review." The man at the head of the table did not flinch. "It is a shift review, and his interventions are central to the data." Vaughn's mouth tightened, but he said nothing. His silence was a form of protest that held no weight here. Down in the ER, the unit secretary received the request and hesitated before she spoke into the intercom again. Her voice sounded thinner now, more formal. "Nurse Hart to conference room B." Heads turned. Not all of them, but enough. Caleb heard his name and felt the brief stillness inside his chest before his body moved. He finished taping Savannah's line, confirmed her oxygen, and looked at the provider. "She's stable enough for now," he said. The provider nodded. "Go." Luis watched Caleb step away. His gaze held steady, and for a second it looked like he might say something, but he did not. Caleb did not need reassurance. He needed space. Caleb walked through corridors that were quieter than the ER, the hospital's polished floors reflecting lights that did not flicker. His shoes made soft sounds measured. People passed him without looking up the way they always did. Conference room B's door was closed. He knocked once and entered when a voice called him in. The room felt colder. The air smelled like paper and stale coffee, not blood and dust. Caleb stepped to the side of the table. Hands relaxed at his sides, posture straight. The man at the head of the table looked at him. Nurse Hart. "Thank you for coming." Caleb nodded once. "Yes, sir." The nursing supervisor gestured to the screen. "We are reviewing the shift. Your name appears frequently in intervention logs. We need you to walk us through your decision-making." Vaughn sat with arms crossed, eyes hard. Marissa watched Caleb with a guarded expression. Not friendly, not hostile, like she was waiting to see whether he would defend himself or simply speak the truth. Caleb did not start with a story. He started with facts. At 12:47, he said voice-even mass casualty was called. "I was assigned overflow and secondary. I monitored green and yellow patients and staged supplies. At 1:38, patient Dylan triage yellow showed signs of decompensation, hypotension altered, and vomiting with decreased oxygen. I initiated airway positioning suction and assisted ventilation with respiratory support. Fluids were pressurized. He was moved to a trauma bay when available. Risk management held up a hand. You initiated assisted ventilation." Caleb met her gaze. "I did not intubate. I did not administer sedation. I assisted with bag valve ventilation in coordination with respiratory therapy." Luis was not in the room, but his presence lived in the way Caleb described the sequence clean and accurate. The nursing supervisor asked, "Why did you act before an attending was present?" Caleb's voice stayed steady. "Because the patient was losing airway protection. Waiting would have increased aspiration risk and decreased perfusion. The nearest attending was occupied. Charge nurse was managing incoming reds." Vaughn's mouth tightened. "You could have called a resident." Caleb turned his eyes to Vaughn without challenge. "I called for help. Help was delayed. The patient was immediate." Vaughn leaned forward, voice edged. "That is not how chain of command works." Caleb did not raise his voice. In that moment, the patient's physiology was the chain of command. The room went still. Marissa's eyes dropped for half a second, then lifted again. The administrators did not react with drama. They simply listened. The man at the head of the table asked, "Continue." Caleb nodded once and moved to the next point. Multiple minor adjustments prevented false alarms and delayed responses. Monitor leads were misapplied in overflow due to high throughput. Medication verification caught at least 2 near misses. In one case, a dose was being drawn incorrectly. It was corrected before administration. Risk management's pen moved across paper. The nursing supervisor asked who directed those corrections. Caleb did not claim authority. "I spoke to the nurse involved. I corrected the error." Without notifying the attending, Vaughn said. Caleb kept his tone even. It was not an attending-level decision. It was a dosage verification. Vaughn's eyes flashed. "You are describing leadership." Caleb's gaze held. "I am describing work." The man at the head of the table clicked to another slide. Pediatric event. 8-year-old male. Rapid decision to transfer to operating suite. The record shows disagreement regarding CT imaging. Marissa's jaw tightened. Vaughn's shoulders rose slightly, defensiveness sharpening. Caleb's voice remained calm. Mason presented with seatbelt bruising tachycardia. Hypotension altered responsiveness. Those indicators increased suspicion for internal injury and hemorrhage. He was not stable for CT without stabilization. Fast ultrasound confirmed free fluid. Surgery was contacted and transfusion initiated. The nursing supervisor asked, "Did you instruct the attending?" Caleb paused not long enough to be theatrical, long enough to choose exact words. "I stated concerns and recommended stabilization before transport." Vaughn leaned forward, voice sharp. "You challenged me." Caleb met his gaze. "I challenged the risk of delay." Vaughn's jaw flexed, and for a moment he looked like he might argue further, but the screen behind Caleb held the truth in cold lines. Mason's blood pressure. Mason's heart rate. The moment the ultrasound result appeared. The time surgery was called. The time the OR doors opened. The man at the head of the table asked Vaughn doctors the clinical assessment accurate. Vaughn's eyes flicked to Marissa, then back to Caleb. His pride fought the room and lost, because this room was not built for pride. "It is accurate," Vaughn said, voice tight. Marissa exhaled once small. Risk management leaned forward. "Nurse Hart, your charting is unusually detailed." Caleb nodded slightly. "It is consistent." The nursing supervisor's eyes narrowed in thought. "Your calm under pressure was noted by multiple staff." Caleb did not react. Compliments were not what he came for. The man at the head of the table turned to Marissa. "Charge Nurse Klein. Given the conditions, do you feel his actions created risk or reduced risk?" Marissa's throat worked. The answer cost her something. "Reduced risk," she said. Vaughn's mouth tightened, but he did not interrupt. The man nodded, then looked at Vaughn. "Doctor." Vaughn's eyes lifted, expression guarded. The man's tone remained neutral. "Do you dispute that his actions contributed to the outcomes?" Vaughn held still for a moment, as if immobility could keep the room from asking more. Then he spoke, and the words sounded like metal cooling after heat. "No," he said, "I do not dispute it." A faint shift moved through the room. Not celebration, a recalibration. The man at the head of the table said, "Nurse Hart, your decision-making tonight appears clinical and consistent with patient safety. However, the scope boundaries require clarification in writing. That is an administrative process. We will handle it." Caleb nodded once. "Yes, sir." The nursing supervisor closed her laptop, slightly gazed still on Caleb. "Do you intend to remain in this department?" The question landed with more weight than it should have because it asked for commitment in a place that had treated him like a shadow. Caleb's eyes drifted for a brief moment toward the small window in the conference room door. Through the narrow glass he could see a sliver of corridor light, pale and thin, as if morning was trying to find its way into the building. "Yes," he said. The word was simple. It did not beg. It did not bargain. Marissa's face changed subtly, her jaw unclenching just enough to show fatigue. Vaughn stared at the table for a beat, then looked back up. Something like reluctant respect shifting into place, not warm, but real. The man at the head of the table nodded. "Then return to your shift. We will debrief further when patient volume allows." Caleb nodded again and stepped back from the table. He turned to leave, then paused long enough to meet Marissa's eyes. Marissa's voice was quiet, roughened by the night. "You should have called sooner." Caleb's tone stayed even. "I called. You were buried." Marissa swallowed. "You made me look bad." Caleb met her gaze without flinching. The night made all of us look honest. Marissa stared at him for a long beat, then nodded once, a small concession that did not sound like an apology, but carried the shape of one. Vaughn spoke as Caleb reached the door. His voice was quieter than before. "Hart." Caleb turned. Vaughn held his gaze, pride still there but tempered. "Your judgment tonight kept people alive." Caleb nodded once. "Yes, sir." He left the conference room and walked back into the corridor. The hospital felt different now, not kinder, just less blind. He returned down the hall toward the ER, and the sound grew louder with every step until the doors opened and the department swallowed him again. Inside, the pace had changed. The sirens outside were fewer. The ambulances had cleared. Hallway beds still lined the walls, but fewer patients were shouting. The noise had shifted from frantic to exhausted. Savannah was being prepped for a small chest tube insertion, the provider explaining quietly while Savannah tried not to cry. Louise stood at the head of her bed, hands steady, guiding her breathing while the supervising physician arrived. "Good," Louise murmured when he saw Caleb return. Caleb glanced at Savannah and saw her oxygen number holding. He nodded once. A nurse passed Caleb and hesitated, then spoke softly, as if the words were new in her mouth. "Thanks for earlier." Caleb nodded. "You're welcome." The shift dragged toward dawn. There was no moment where chaos ended, It simply thinned like smoke after a fire, leaving ash in the muscles and heaviness behind the eyes. Mason's mother emerged from the family room with the social worker at her side. Her face was blotched, red hair tangled, hands clenched around a hospital bracelet someone had given her to hold. She saw Vaughn in the corridor and rushed toward him. "Is he alive?" she demanded, voice breaking. Vaughn's expression shifted into the practiced seriousness of a man who had to speak in careful truths. He guided her toward a quieter corner, speaking low. She listened, then pressed a hand to her mouth and nodded, tears spilling without sound. The social worker held her elbow. Vaughn's shoulders sagged a fraction when she turned away, the weight of the night settling into his bones. Marissa moved past the charge desk more slowly now, the marker finally gone from her hand. She glanced at Caleb once, and this time her eyes did not slide away immediately. She looked as if she wanted to speak, then thought better of it and returned to the board, erasing old names, rewriting new ones. Caleb finished his charting and overflow with the same careful precision as earlier, documenting events as they happened, not as anyone wished they had. His fingers moved steadily, even while the rest of his body felt hollowed out by adrenaline's retreat. When the first pale light crept through the high windows near the ambulance bay, it changed the color of the floor. The fluorescent glare softened under the blue-gray of morning. The ER looked briefly like a place where normal life might exist. A tech mopped a strip of dried blood from the trauma corridor, pushing the mop back and forth until the stain surrendered. A nurse leaned against the wall and drank water with both hands, eyes closed. A resident sat on a stool and stared at a blank wall, breathing slowly as if relearning how. Caleb walked one last pass through overflow checking lines, confirming vitals, tightening a clamp, adjusting a monitor lead that had started to slip. Small tasks, small anchors, proof that the room had not beaten him into carelessness. Luis stood at the respiratory station and watched him. His eyes were tired but clear. "You okay?" Luis asked quietly. Caleb's answer was honest and small. "I'm here." Luis nodded. "That's enough." Vaughn passed through the corridor again, this time without barking orders. His coat was open. His tie was loosened. He looked like a man who had been reminded that medicine is not tidy. He saw Caleb by the charting station and paused. The pause was brief, but it mattered because Vaughn did not pause for people he considered irrelevant. He nodded once. Caleb nodded back. No words. No performance. Just recognition passed between two tired men in a hallway that still smelled like dust and antiseptic. Marissa approached the charge desk and stopped beside Caleb. She spoke without looking directly at him, as if her pride needed a place to rest. "You kept overflow from collapsing," she said. Caleb's eyes stayed on his screen. "You kept the whole place moving." Marissa's mouth tightened, and for a moment she looked like she might argue, but then she let the words stand. She nodded once and walked away. The shift change began. Fresh staff arrived with cleaner faces and coffee cups, eyes widening when they saw the board and the leftover stretchers. The night crew gave handoffs in hoarse voices. Patients were moved. Orders were updated. The machine kept turning. Caleb gathered his backpack and walked toward the exit. His pace was unhurried. Not because he was relaxed, because he refused to rush when there was nothing left to outrun. At the door, he looked back once, not for drama, for a final scan, the habit of making sure nothing was burning behind him. The ER was quieter now. Not peaceful, but stable. Savannah's bed was surrounded by staff, oxygen steady. The trauma corridor had fewer bodies. The waiting room still held people, but the air had shifted away from panic into the long, dull ache of mourning. Luis caught Caleb's eye and lifted his chin slightly, a gesture of respect that did not need words. Caleb pushed through the doors and stepped into the Tucson morning. The sky was pale gold over the parking lot, the desert air cool for a brief hour before heat returned. The sounds outside were ordinary. A car door closing, a distant engine, a bird calling from somewhere near the roofline. Caleb walked toward his vehicle without looking for anyone to see him leave. He did not carry triumph. He carried fatigue and the quiet weight of lives held back from the edge. Behind him, the hospital continued to hum, already pulling in the next set of problems. Inside, they would talk about numbers and protocols, and who said what in which bay. They would file forms and adjust staffing requests that might never be answered. But in the simple light of dawn, none of that mattered the way a single steady breath mattered. Caleb opened his car door, set his backpack on the seat, and sat for a moment with both hands on the steering wheel, still and quiet. Then he started the engine and drove away, leaving the ER behind him, not as the nurse they ignored, but as the one they could no longer overlook.